dealing with common sheep parasites. These are some questions that I'm getting from producers uh, on both large and small operations and are a definite health management issue if not treated correctly. I'd like to kind of first open up with a quote. So a quote from Gandhi, actually. He said that the greatness of a nation can be judged by the way its animals are treated. And I think ultimately that's the goal of all of us as producers, as people who have animals under under our watch to make sure that they're healthy and happy. And that is a big part in why us in Extension try to have outreach to make sure that all of us can keep our animals healthy and happy and ultimately productive in the end. So, like I mentioned, today's topic will be mainly entirely on how to keep good sheep and goat health with dealing with some of these common sheep parasites that we have. And there's a vast array of these different types of sheep parasites that are dealt with sometimes on a day-to-day basis. And there are so many that, I'm not going to go through all of them today, but knowing that there are two specific groups. One is the external sheep parasites. These include things like sheep keds, biting midges, that spread, certain diseases like blue tongue or sheep lice or bot flies that lay larvae up in the nasal cavity of sheep. I mean, these are all, each one kind of has their own specificity of what type of animal they like. Also, their life cycles are vastly different. And then secondly, we have internal parasites. And generally these are protozoa or different type of worms or maybe liver flukes that our sheep and goats deal with. And we'll go into more specifically a couple of these, but due to time restricted, we will not be able to go into all of them in depth. So the first one I'd like to talk about is the sheep ked. So the scientific name for the sheep ked is Melophagus ovinus. And oftentimes we look at sheep keds, if we see them on our animals, we identify them and call them a tick. And, there is some justification to this because they are blood feeding animals. They do have a section on their body that fills up with blood, and they do look similar to a tick to maybe an untrained eye or someone who's not completely familiar with all these different types of insects and parasites. But really what these sheep keds are is they are a type of wingless fly. So they're a little bit different where maybe a tick is more like an arachnid, okay? So they spend the entirety of their lives on sheep, and they generally transfer from animal to animal by contact, rubbing up against each other in close proximity and things like that. So as some of us think about our kind of backyard operations, having some of that confinement increases the passing back and forth of these types of parasites. And then obviously they feed on blood like we just talked about. An adult female ked can live for about 4 to 6 months and produce up to 20 larvae. So in the pictures at the bottom of this screen, you'll see that on the very left-hand side and in the middle identifies what an adult sheep ked actually looks like. And so you can see that they're a little bit different looking than a tick, but nonetheless have a large cavity that shows where they fill up with blood, and that gives them that tick-like kind of appearance. On the very right-hand side, we see larvae inside a pupal case, and those are generally kind of cemented to the wool or the fibers on the side of the sheep. One thing that is nice is that these particular sheep parasites, keds, they are very species specific. So if you're handling a lot of sheep and you get keds on you, there isn't a great concern that they will latch onto you and feed on you and transfer different diseases. So there is some comfort in knowing that sheep Keds are very specific to sheep. So that's one thing to think about. But there's some other aspects of sheep Keds that help us identify and treat them. So here's a really good study that was done looking at the seasonal movement and spatial distribution of the sheep Ked. So a study that was done on Wyoming sheep saw that the sheep Keds liked to populate mainly on the ribs, shoulder, and thigh of the animal. So in the little diagram of the sheep on the left bottom part of the slide, we see all the different labeled portions of the sheep. And you can see the area along the midsection, the thigh, the ribs, and the shoulder. And that's generally where we'll see the most abundance of sheep Keds. The belly area generally has a really short staple length or wool length. And so sheep Keds don't like to hang out there much. And they also don't like to hang out on the back area or the loin very much. And this can be what is challenging sometimes with finding them, because if you're always kind of running your sheep through a little chute system or alley, you can look across the back and maybe you don't see any type of sheep Keds. But generally, that's not where they hang out anyway. And so making sure you kind of look at the side of the animal and part some wool is generally where you'll see these populations at. So the populations fluctuate depending on the time of year. So these populations increase during cool seasons and in fall and spring. So we can see that in those cool seasons, these sheep Ked populations start increasing in February, March, April, May, June, and then during June and July, when those summer months start getting really hot, these populations decrease. And what is actually convenient about this is that during that same time in the springtime, when the months are fairly cool, these populations will be highest. And so this is also the same time where we shear and generally treat these specific parasites. So some of the impacts that can happen and why it's important to really take hold of this situation and treat our animals is because there are economic losses due to sheep Keds. So one of the biggest things is pelt damage from that parasite feeding on the animal, and it causes areas on the hide that won't take dye appropriately. So in this picture on the screen, we see a tanned sheep hide, and you can see the areas where the sheep Keds were feeding and how it did not take the dye. So this really drives down the value of our pelts if you're trying to sell pelts to people. And furthermore, it actually reduces weight gains in our animals. So we can expect roughly an 8% reduction in weight gains of our animals. And maybe this doesn't sound like a lot right away, but if we're trying to market lambs, and currently lamb prices are pretty good, they've swung up pretty good since COVID really started. Losing, 8 pounds on a 100-pound lamb, that's quite a few more dollars you could have had in your pocket if not for sheep Keds. It also reduces the quality of your wool. Heather, who's going to speak after me, she'll go into more about wool and some of its characteristics and quality, but sheep Keds can drive down the quality of the wool and actually reduce the wool yield and give it a poor color and texture. And so if we're trying to market some fleeces for hand spinners or even on a commercial basis, this can drive down the price. So, and then in some instances, if there's heavy infections in lambs, this can cause the lambs to become anemic. So looking at treatment. So we had talked about how the sheep Ked populations fluctuate depending on the time of year, and that during those cool season months, from February to about June, we saw those populations were the highest. Well, like I had mentioned that we generally shear sheep around that time. And it's because we're generally lambing around that time in the springtime. So one of the best things that we can do for this external parasite is to shear our sheep. Shearing our sheep can reduce the sheep Ked population by 75% by itself. And this also reduces, if you get that wool off the ewe prior to her lambing, this reduces the chance of that ewe passing some of those parasites off to her lamb and ultimately infecting her lamb with the same parasite she was holding. So right after we shear our ewes, and we're generally shearing them in late pregnancy, we want to treat them with some kind of pour-on permethrin-based drug that kills these different parasites. And so here's just an example of one I put on for a pour-on insecticide. But there are several on the market, and all are very effective with a permethrin base to them. So after shearing, make sure that you treat those animals with a pour-on, and then it'll be the most effective. And then if you do decide to purchase new animals that come into your flock, not only is it a good idea to isolate them for a portion of time to make sure that they're healthy and you're not bringing any kind of disease into your flock, but also treat them with this similar pour-on to make sure that you cover any of your bases so that you're not introducing any external parasites like Keds or lice to your flock if you don't already have them. So moving on to some internal parasites that are pretty common. The first one that I think of is Coccidia, and this is a protozoa type parasite. And it's a little single-celled protozoa that damages the lining of the small intestines. And this generally manifests itself in diarrhea and sometimes may contain some amounts of blood or mucus. And so these animals that are most susceptible are generally maybe some of our geriatric animals, our older animals, or oftentimes our young lambs and are animals that are struggling with maybe some other disease. And so when their immune system is down, these protozoa can have a pretty bad impact on them. There are a couple different treatments that you can do to slow this down or to keep these clinical signs from showing up in your flock. So there's a Bovatec or decox, a decoquinate added to like a salt or mineral mixture is really good. And then also in Corid or Amprolium that we can be added into the drinking water if you have like a stock tank and you can mix in some of this drug to help with this protozoa. The next big parasite that I really wanted to talk about today, and that is of concern in a lot of small ruminant owners, is the Barberpole worm. So the scientific name for this particular worm is called Haemonchus contortus. So this is a blood-sucking parasite also, and it's given this name, the Barberpole worm, due to the fact that when you look at it, it looks somewhat like a barber pole in that it's striped in red and white. And the way that this particular parasite is designed really is to latch on to the abomasum of the sheep, which is their stomach, the last section of their stomach, and feed on blood. So, and reproduce. And that's all it does is feed and reproduce. So the red section in the striping is blood and the white is eggs. Okay, so blood and eggs is pretty much what gives them that Barberpole worm look. Some of the symptoms that you'll see with this particular parasite is first a pale mucous membrane indicated on the right-hand side picture of the eyelid of that sheep, edema under the jaw, we call this bottle jaw, Some other internal parasites cause a similar look. Ill thrift in our sheep. So if they're looking pretty lethargic and they're not doing well, and one thing with sheep is if they're off hanging out by themselves, that's not a good sign generally, and you want to investigate why they're doing that. So if their ears are droopy and they're off by themselves, that is unlike sheep. Sheep are an animal that really like to be with each other. We call that being gregarious. They like the company of one another. And then sometimes if you're don't have a keen eye to it, sudden death. Okay, so these worms, depending on how fast they're populating and what the burden is on your animal, can cause death pretty fast. So how can we tell what kind of internal parasite we're dealing with? Well, one of the things that we can do is called fecal egg counts. And what this does is we take a sample of feces or sheep poop, particularly we'd want fresh feces, and we would put it under a microscope and we would count how many eggs there are, and we'd also look at what type of eggs there are. So doing a fecal egg count gives us a good identification of what type of internal parasite we're dealing with and what kind of burden they actually have. So generally in a flock, about 20% of our sheep will carry 80% of the parasite burden. We can do this here. There are other labs that can do it, but here at USU, we do this in our vet diagnostic lab, and it's about $10 to run a fecal float or a fecal egg count. And all you really need to do is send in about 3 ounces of fresh feces. So a little more, just a small Ziploc bag is sufficient to send in to get an idea. On this image here, you can see the difference between that Barberpole worm or the Homonicus egg, which is much larger than the Coccidia egg, which is that single cell protozoa. Okay. Some of the treatments that we have to deal with the Barberpole worm include several different families of drugs. Okay. And when we're treating our animals, one thing that we really want to remember is that the dosage is important. So if you can't weigh all your animals, treating for probably your largest animal is the safest way to go, because we don't want to underdose our animals. And we'll talk about why we don't want to do that in just a minute. So some of these drug families include benzimidazoles, which includes valbazin, which is a pretty popular drug we use, nicotinics, which includes prohibit, and then lactones like ivermectin, which is also a very popular drug. And each one has their own set of rules of how soon you can slaughter after, whether or not you should do it during pregnancy or not. And so making sure that you read the label is vital to this.
Chad, you got 5 minutes till questions.
Okay, thank you, Ben. So one of the issues that we're starting to see is that these worms, these Barberpole worms, even with the drugs, there are still a small percentage that live. And these percentage that live are starting to slowly become more and more resistant to our drugs. And so we want to make sure that we do things that make it so we can continue to use our drugs for longer periods of time. These drugs are hard to develop. There's not a lot of money going into the research and development of them. And so making sure that we can use these as long as we can is vital. In the South, there are some flocks that have become completely resistant to all the drugs, and none of them work on their flocks. So some of the things that we don't want to do is we don't want to underdose our animals. We also do not want to treat all our animals, even the ones that are healthy, because then we're treating all the worms at the same time. And then we also don't want to move animals to clean pastures after deworming. If they're going to shed a bunch of eggs afterwards, we want to make sure that they're in padlocks that are maybe already infested. So how can you tell if your dewormer is working? Well, you can do a fecal egg count reduction test. the first thing you do is do a fecal egg count on a number of sheep in your operation. Then you would treat them with your particular dewormer you're using, wait a certain amount of time, a week to 10 days, and then do a fecal egg count again. So if there's a 95% reduction in those egg counts, then those worms have not built up any resistant, and that particular dewormer is working for you. If there's less than a 60% reduction, then you're starting to develop some serious resistance to that particular dewormer. So identify the one that works for you and then use that with selective treatment until it loses efficiency. We used to say that you should rotate through different dewormers, but now the consensus is that you should use one dewormer that works. Make sure that you only selectively treat those animals that are in bad condition. And we'll talk about how we do that just a second here. We know that this is a problem in the South, but is it really a problem in the West? Well, there was a recent study just done last year that showed that irrigated pastures, even in the Intermountain West across Montana, Wyoming, and a location here in Utah, are still problem areas for the barberpole worm. And as the percentage of our our farms increase that are in smaller acreage from 1 to 9 acreage, as they increase, we're seeing more and more sheep operations on irrigated pastures. And so this is something we should think about, which leads me to our tool for doing selective deworming. And this is called FAMACHA. And essentially what we're doing is we're reading how anemic the animal is based on that mucous membrane next to their eye. So we score it on kind of an objective scoring of 1 to 5, how anemic they are. And what we do is we only treat the animals that are more anemic. So if they score a 3, 4, or 5, we treat them with our dewormer. And if they're not scoring that high, if they're only at a 1 or 2, we don't treat them at all. And what this does is it keeps a certain population of parasites that have never been exposed to our dewormer. And so it will stay effective on those particular parasites within our flock. So this works both on sheep and goats. And then there's a website that's really good that some of you may want to write down called WormX. And this info is a great site to obtain information on internal parasites. There's also genetic components. So if your sheep aren't doing well, maybe you need to think about a breed that does a little better. So breeds like St. Croix or Katahdins do really well with higher parasite loads and aren't quite as susceptible to the effects of internal parasites. But if you continue to choose those animals that aren't as affected as much, then there is some heritability to that, and you can have a flock that is more deals with parasites better. So in summary, external and internal parasites in sheep and goats should be taken into consideration when designing a health plan for our animals. Shearing should be done prior to lambing to help reduce any external parasites that pass to that lamb. And then we can't really completely eliminate all internal parasites, but we can learn to effectively manage our sheep and goats with them through things like selective deworming and using FAMACHA. And then FAMACHA is a useful tool to help extend the life of our dewormers, something that is a very valuable tool to us as farmers of these sheep and goats. So I know I kind of sped up a little bit at the end, but with that,